All right, welcome everyone. Thank you for joining us today. Before we hop in, I wanted to quickly set the stage on why we're here today, why we've invited you all. So more and more of our customers are asking us for advice on how to deal with the current and continuing spike in COVID cases, particularly around the Delta variant, how they can better equip their staff, provide safety, security to their patients, and handle the enormous effort that's required to get their patient base fully vaccinated. And so the silver lining, the good news is that we've been here before. So we wanted to share with you our team's experience and give you a better understanding of what it will take to implement a system that can not only get you through this current challenge, but set you up for success in 2022. So I'll turn it over to our CTO and Luma Health's co-founder, Aditya Bansal, to take you through our journey. Please feel free as we go through to leave questions in the chat. We'll spare the last few minutes to address as many as we can, and anything we're unable to answer in this call will be answered in a follow-up email along with the link to the webinar.
Awesome. Thanks for the introduction, Josh. Appreciate it. And as Josh said, my name is Aditya. I'm one of the co-founders and CTO here at Luma. And I've been kind of helping instrument a lot of the experiences that we've built to kind of help reimagine the patient experience, both through the first wave of vaccinations back in the winter and spring, but also really helping to move forward now into what's going to be a very changing time as the Delta variant picks up and kind of the vaccination strategy evolves. So to start, I'd like to begin with a small little background about Luma Health, with all of us wearing these very typical Silicon Valley hoodies. We created Luma Health, me and my partners, a really simple vision, which was to get healthcare out of the way of healthcare. And to do that, what we aimed to really build was a software solution and a platform that helped automate all the various points along the care journey that introduced friction between a patient wanting care and a patient being able to get access to care. And in order to do that, we really had to meet the patient where they are, whether that's on mobile, the web, via phone call, email, all the various touch points that a patient's required or they start to think about when it's time to get access to care, and ensuring they're well situated in the moments ahead of care and then post-care. So what we built at Luma was what we call the patient journey platform. Now, when we looked at the market, looked at kind of the experiences that patients are having, the various touch points that patients need to engage in order to have a successful visit, whether it's in primary care, specialty, or any other like ancillary lines of service, really kind of the core elements were sort of the same in many aspects. So whether it started with an annual wellness reminder in order to then lead into a blood test that kind of went from there into a referral to a specialist, to maybe a highly impacted specialist such as an endocrinologist or a gastroenterologist, being able to help the patient automate any intake forms that were necessary from there, appointment reminders to kind of make sure they knew what they needed to do to get access to that care, all the way down to post-visit consultation, any telehealth follow-ups, recalls, and then scheduling. The patient's journey really is a kind of circular path when a health system really looks to actually engage a patient in order to understand the patient at all points along that journey and provide services to them across that entire environment. So we've been very fortunate to be able to build this and been recognized by Class Research as the standout engagement vendor in patient engagement in 2020. And so we've built a lot of solutions that really became very, very valuable as COVID both picked up in the early part of last year, and then as the vaccination efforts really picked up on a national scale towards the end of last year and the beginning of this year. Our vaccinations efforts and kind of ways that we've helped health systems with vaccine operations, as we call them, really are being able to perform these activities, both of the complexity of your health system, but at scale of the entire American population. So when we started kind of building what we call vaccine operations, we knew we had to have a solution that could help health systems such as yourselves be able to connect with your entire patient population, whether that's patients you haven't seen in 2 to 3 years to let them know of availability, or patients you just saw in an ED and you're looking to do a discharge, and part of the discharge was you wanted to make sure that they got scheduled for a vaccine visit as well. So we stood up our platform and really used capabilities that existed inside of Luma to get nearly 1 million patients engaged, send over 500,000 broadcasts. We scheduled actually quite a bit more than 600, closer to actually 2 million vaccine appointments now, and actually done maybe over 1 million intake forms. So lots of very different kind of solutions that we were able to build on our platform for the variety of different needs that existed at different vaccine deployments. And the reason I'm talking so much about this is with the rise of the Delta variant, with the rise of the various different, now the kind of moving targets around how we're going to do booster shots, how we're going to do the third shot, how we're going to actually extra vaccinate the immunocompromised. Every health system has a slightly different approach and needs a slightly different strategy. And the only way to do that is to have a comprehensive platform that's both adaptable at scale to the various needs that a health system has or a clinic might have, and also adaptable to the scale at which, you know, hundreds of thousands of people in your local geography are coming to you for an answer. So I'll give a couple examples right here. So UC San Diego Health System, kind of on the right side, big academic medical center in San Diego in the La Jolla and Hillcrest area. They really needed to communicate with hundreds of thousands of patients who are coming to the Petco Park mass vaccination site. You know, there was having, you know, if you remember back in March, April, May, there was a lot of shipment issues with massive winter storms. They weren't getting the vaccines on time a lot of times. So they had to quickly reschedule and message hundreds of thousands of patients who were actually trying to get access to that scheduled appointment. If you look at Cook County Health, the second largest county in America, we were able to help provide services there that really helped them vaccinate about 500,000 residents or something akin to that, 200 to 500,000 residents in the Chicago area suburbs, all the way down from running the mass vaccination sites with scanning QR codes, down to running clinic vaccination sites where people could schedule online or schedule actually from post-ED discharge. So various kind of large health system kind of opportunities, but also, you know, in FQHCs where community health happens, whether it's examples like Ryan Health or East Boston Neighborhood Health Center, really helping them kind of set up a very bespoke, very custom solution that met the needs of their specific populations, whether it's a high Spanish speaking population or whether it's a population that may not necessarily have access to the desktop internet, being able to send messages via text and then letting them schedule directly from there in order to receive their vaccines. So we were able to really stand up this large vaccine operations to really provide access to vaccines for millions and millions of patients. So we scaled, you can kind of see some graphs here on the right side, which kind of my brain is like, so steam comes out of my ears helping support some of these things. But we were at our peak. Luma kind of is built at capacity to basically schedule multiple Beyonce-sized concerts a day. So whether you're scheduling 50, 100, 200,000 patients in a single afternoon, that's the kind of operations that we were able to scale. Now, with the third dose, with the booster shots, it's going to look a little different. And we'll talk about how we think it's going to look different and what we've already seen. But we really started to come out of that experience of that incredible crush load in March, April, May. You saw it all over the news, healthcare websites crashing, unable to get access to care. You know, we were able to kind of provide a scalable solution. What we really got out of that was a battle-tested platform that we built, you know, in the 6-7 years that we've been building Luma, applied in a novel way to help health systems such as yourselves, FQ such as yourselves, community clinics such as yourselves, really build up and perform vaccine operations in a very unique manner that was specific to the various populations that these various service systems were servicing. So we're all very aware, kind of, it's in the new national conversation, it's in the national zeitgeist right now, that the Delta variant is, you know, up and to the right. I don't have to tell you what's in the news that we read every day. But I think what's been kind of really interesting is, I'll take my brain and hopefully collectively all of your brains back to, you know, March of 2021, when we launched the first mass vaccination Johnson & Johnson site in suburban Chicago. One of the things that came up on one of those early calls that we were having setting up those locations was, I wonder if we're going to have to do boosters in the fall. Because it started coming up a little bit in the dialogue around the J&J single shot. Things were like, wow, this is amazing, but is it going to be enough, provide enough immunity, all that sort of stuff that's going to last through the next winter coming up? And so, if anything, the timeline around those dialogues has now been accelerated. We're now sitting in the late part of the summer. The prevalence of Delta has now become the predominant form of COVID in the United States. And the dialogue really around these extra shots, these extra vaccine doses is kind of front and center of the national healthcare dialogue. So what we've seen is, you know, recommendations from the administration that a third shot will be required after 8 months after the last dose of a 2-dose mRNA regimen. We don't know yet what's going to happen with the J&J vaccine, but we have early data from the United Kingdom around the AstraZeneca product and then potentially requiring a second shot there. And what we see now is also health systems. So we have a lot of data that's showing that, yep, this is happening. And what's going to end up happening really is the United States did peak vaccine scheduling between March and April of this calendar year, which means 8 months after that is going to put you in November, December, January of this calendar year. So what we're working towards is making sure health systems are prepared for that onslaught of patients who are going to need access to care, who are going to want that sort of vaccine solution in order to get access to that third booster shot. The other interesting part now is, so that's looking forward, but looking into the today element, what we're starting to see a lot of is the immunocompromised are already receiving boosters. Talking to some of our health system partners, FQ partners in the last couple of days, the first immunocompromised boosters are already going into arms. And so it's the tenor of the third dose, the kind of volume of the demand is starting now, and it will only start to increase as we get into the fall and winter of this year. So when we look forward to kind of how we're going to help those health systems and how are they going to be able to be successful, there's two ways that you could approach the solution and two ways to approach the problem. Number one is to kind of cobble together a set of solutions based on what you might already have, what you might already be kind of working with, and then maybe solve only scheduling. Or you may only be able to solve messaging, or you may only be able to solve intake forms. And that's an approach. But what we've seen really is our leading partners with the almost 600 customers that we have is taking a more integrated, more platform-oriented approach is like kind of the Swiss Army knife needed to kind of handle the changing dynamic in the market. Whether the market is moving from single dose, second dose, third dose, whether it's now we're going to have a Johnson & Johnson booster shot, which is kind of like footnote really in the national dialogue, but whether that becomes sort of like the megaphone, there's 14 million Americans who've received the Johnson & Johnson product. So they will need to be serviced in some way. And so being able to message them at scale, being able to schedule them at scale, being able to make sure they show up at scale for all your populations. And also one of the other really interesting things that'll happen is between when a lot of Americans receive their first and second doses in April, May, June, they may not be where they were today. So they may be coming to you as a health provider, having received care in California, but now they're in Texas and they want to receive that third dose in Texas. So being able to actually accommodate for a variety of kind of changing scenarios is actually going to become a really important reason why having a platform as opposed to a set of small solutions will really help you as a health system, a clinic, a provider group solution what the future of your delivery will be. So that's kind of where Luma Health comes to play. An entire set of solutions and products that makes it easy to craft a patient journey, whether it's vaccine related, whether it's third dose related, whether it's the first dose after when you see a patient for an annual wellness visit or an attribution list or whatever you might want to see a patient for. An entire set of solutions that makes it easy to build that journey that moves patients along from the point they know they need care to the point where they receive care, and then they can follow up about the care that they receive. Being able to assemble all those is a platform. It requires a comprehensive set of solutions that help guide and navigate patients along that journey. So I'll stop there. There's a lot that we talked about. I know there's a couple of questions that came up, so I want to leave ample airtime for that. Otherwise, this becomes a bit of a monotone. So I'll pause, and Josh, if we've got questions, I'm happy to take them.
Absolutely. The first one I think you've addressed, but maybe to dive a little bit deeper, how will booster rollouts look different than the previous COVID vaccines?
Yeah, I think there's kind of two main elements to where boosters will look different than kind of the first wave of COVID vaccines. Number one is you're going to have a patient population that isn't necessarily the same who received dose 1 and dose 2 with you. People move, but they still need access to that care. So platform solutions are going to require, and scheduling solutions are going to require the ability to understand if the patient received the first or second dose with you, if they're within the eligibility window, which is going to be very, very different. And if they didn't receive care with you from the first or second dose, are they going to need to be able to prove vaccination status, prove the date in which they showed received the vaccine, and then schedule at the appropriate, like clinically appropriate time for that. So a lot of the work that we've done with kind of our leading customers who are getting ready for this is be able to build workflows in our intake products that receive a photo of their COVID vaccination card, understand what the dates were for that, and help the patient understand you'll likely be eligible in November 14th. So see you in a couple months, but it's not ready yet. But are you immunocompromised? let's get you in, let's get you scheduled, let's get you vaccinated.
Perfect. A question: How do we screen for eligibility?
Yeah, and I think screening for eligibility is exactly, being able to receive a proof of documentation from a patient, being able to flow that image of that vaccination card or the entered in lot number, the product type, the location that you gave it in at, flow it directly into an EHR using, direct messaging, show it in an Epic and Media Manager and Athena Document Manager, all the various places where you can receive clinical and operational documentation from the patient, being able to receive the documentation and then build schedule templates and scheduling rules that derive off of the answers the patient gave are going to be kind of really important parts to the build that are required to provide third and booster shots.
Okay, thank you. And then there was a question around workflow. If we're able to, once we integrate, will we be able to detect who had the last booster automatically and send a reminder to schedule the next booster, or is it a manual entry?
Yeah, no, it's a great question, Josh, and I appreciate the questioner who asked that, because I think it's one of the powers of when you actually apply a platform as opposed to a point solution. Because we have Luma ourselves, we have deep integrations with about 80 different EHRs. We can build a large set of complex workflows on top of that. So we can find every patient who came in for for their second booster shot on March 17th, or their second shot, not their booster, their second shot on March 17th, lasso them into a population and send them a broadcast message, say, you're now eligible, and just actually start to build the demand from the top of the funnel, to use a marketing expression, and have those patients actually then start electing to self-schedule. So completely the goal here is to completely automate the workflow for these patients and for the staffs of the health systems who are joining us today, so that they can actually see, send the messages out with no intervention, get the patients to schedule with no effort, and have a full schedule, for their third dose boosters, come Monday, so to speak.
Perfect. And do we recommend creating a new appointment type for the third booster? A follow-up question: how are other clinics differentiating these patients? Yeah,
I've seen, since I think the recommendation from the CDC or the administration right now is primarily around the mRNA doses, the Pfizer and the Moderna products. My recommendation right now is to actually follow what, the build examples that we saw and we recommended back in, December of last year, which is what a lot of us did was, a lot of our partners did, they build a first dose visit type, because you weren't aware of necessarily what product you had available to dose with on the first dose, and build a second dose, a second Moderna and a second Pfizer. And then we'll also recommend doing a third Moderna, a third Pfizer. So 2 different appointment types, visit types, one specific to Moderna, one specific to Pfizer. And that'll also help pharmacy teams actually manage lots and allocations a little bit better to make sure inventories are tracked more appropriately, so they can actually help to track supply and demand. With the J&J products, it'll likely be just a single dosing visit, which would be a J&J product type. And I think that's just very unique to kind of the difference in how we were in December, where you'd often come in and you say, we've got Pfizer today, we've got Moderna today, and so the second one has to match the first one, but you wouldn't necessarily know what you're going to receive until you arrive for the first one, and then continue that forward. And then with J&J, again, just with a single shot, we'll wait to see, I think, until Luma has a recommendation on how to proceed there, until we understand better guidance from the FDA and CDC, kind of what the prescription, so to speak, will be on how to do boosters for that. Perfect. And then there's a question: on average, how long does it take to get to 50% of a patient population vaccination rate using Luma? Well, I think that's hard, and I think that has a lot to do on population, vaccine, hesitancy, vaccine, digital capabilities in a population, receptivity to a message. We've seen in various populations, we actually, this is a pretty interesting story. We saw in various populations lower take rates because we were actually deployed initially without, say, Spanish. And then what we did was, very soon after, as a fast follow, like a week or two later, we built Spanish-based messaging for those populations. And because Luma has an integration with the demographics, we're able to switch that messaging automatically to Spanish. So if the patient was in like a 2 to 3 kind of message cadence where he said, like, we have the vaccine, schedule when you want. We still have the vaccine, schedule whenever you want. And then the third message kind of automatically, because we finished the build in Spanish, switched to, get your vaccine in Spanish, the take rate actually jumped quite a bit. And so getting to 50% is kind of a hard metric to really say, outside of kind of one of those things to understand where it'll be. But I think a lot of it has to do with building a culturally competent set of communications and a culturally competent set of workflows. And so in certain populations, it's that Spanish example I gave, but other populations, it requires more kind of primary source education, to maybe dispel any myths that might exist for the vaccine. So actually focusing more on education rather than the request to scheduling, and make a request and scheduling maybe be the third or fourth message that happens in like a 4-week campaign that we build towards those patient pops.
That's actually a good segue into another question, which maybe we can.
Wow, lots of great questions today. I love it.
But what can we do to educate patients who haven't been vaccinated and drive them to get more vaccinations?
Yeah, I think if I had the answer to that, we'd be running the CDC maybe. But I think there's just there's a tough dialogue there to have. I think the number one thing to kind of look at is just, primary source education, right? And then fact-oriented education. I think it's very challenging because, with both disinformation and hesitancy just kind of, writ large, there's a challenge around being able to do that. I think what we've learned from a lot in the last year or so was both fact-based kind of information is important, but also a second part that I also layer in is peer-based education, where, I can see people like me have done this. And I think a lot of health systems that we worked with produced actually very quick kind of YouTube videos of, some of their patients. If they got patient consent, it was kind of a marketing effort, obviously. They got patient consent, say, would you like to talk about, getting the vaccine? Did it hurt? What did you feel like? One of the reasons people drop off from the second dose is kind of people know that you get sick after the second dose, and many people can't afford the day off, like if they're going to get sick for a day. And so being able to say hey, I got the second dose, it was on a Friday. I got it Friday afternoon because the clinic runs extra spots on Friday afternoon because in case you're sick on a Saturday, so it's not necessarily going to cut into your work time. And so being able to actually do this peer level conversation and be able to put that in front of patients in critically important in a culturally competent way is I think one of the areas where we can kind of help kind of dispel that and drive actually vaccine uptake.
All right, wonderful. And I believe it's a similar question to earlier, but if patients can provide images of their vaccine cards using Luma to ensure eligibility for that third dose.
Yeah, exactly. And that's one of the kind of workflows we were describing a little earlier, is where patients can actually go to they would receive a text message, easy peasy, click and say, you're ready. Would you like to schedule your booster appointment? Click here. Click there. They go to a customer branded, like Health Center, FQHC branded, CHC branded portal that's actually powered by Luma. They upload their documentation, their actual image, whether they take it from their phone, snap a photo, or they, take an image from, a state portal or whatever it is, upload it. You as a clinic would actually have then a PDF generated, which is the image, the patient's signature on it, the e-sig, all powered by Luma. And when that's completed with the e-sig, be able to schedule right there, whether it's from eClinical, Epic, NextGen, whatever it is, being able to schedule right away, land it in the EHR, and then off to the races with the rest of the engagement. Appointment reminders, cancellation management, wait lists, whatever the pieces that are needed in order to get that patient to actually complete that third dose appointment. I think you switched accidentally on a mute, Josh.
You are absolutely right. I think we can take on one more question. So
okay, let's do it.
Let me dig through them really quickly. Okay, can we provide data as to who's received a vaccine in the CDC format?
So I think there's a lot that we can do. Normally on those sorts of elements, we look to the EHR as the clinical record, and then anything that goes into immunization registries, state level immunization registries are normally kind of components that in a build that we do are owned by the EHR. Clinical documentation, because effectively CDC docs are clinical documentation, state immunization registries are clinical documentation. Our approach there is normally, we'll help you get the patients into the seat to get the shot into the arm, and then let the EHR do what the EHR does best, is provide the clinical documentation therein. So that's really kind of how we would approach doing a build where the CDC doc requirements are kind of top of mind for a health system partner.
Perfect. All right, well, thank you very much, Aditya. Thank you so much, everyone, for attending. Before we all go, as a reminder, we'll send a link to the webinar out in a follow-up email, along with answers to any questions that we didn't get to address. We'd also love to set up individual time with anyone who'd like to connect with our implementation team, so we can go into further detail about change management, how you can think ahead and be able to successfully implement the platform at your clinic. So I know everyone's at different stages in their evaluations. So if you're interested, reply back to the follow-up email. We'll be in touch to set up some time.
It's a pleasure, everyone. Great chatting with y'all.
Thanks, everyone.